Treatment of valvular heart diseases. In line with my last blog on the topic of valvular heart diseases, let's now understand the treatment methods for these conditions. There are various treatment options, depending on the type of ailment. But first, let's briefly review the blog to understand the complex terms that will be used further in the video. Let's begin with understanding the term stenosis. Stenosis is a condition seen in the heart valves when the valves are unable to open and close properly due to the previous deposition of calcium ions, or they are fibrosed. As a result, they become stiff. Now, in regurgitation, the heart valves can't close properly, leading to a poor seal. Hence, the blood cannot move in a unidirectional flow as desired. Regurgitation may be a further complication of stenosis, but we gradually see regurgitation in stenosis conditions. There are two main methods of treatment through medicines and treatment through surgical intervention. We will discuss these in the same video shortly. Now, let's move to understand the treatment of valvular heart diseases. But before the treatment, we must perform some tests to pinpoint the ailment. The most popular and widely used test is called the Echo 2D Doppler test. Here, a probe is placed in various positions on different places of your chest cavity to view the activity of the heart. We also cannot forget the ECG test, where several leads are placed on your chest cavity and 4 out of the 10 electrodes are placed on the 4 limbs, and the other 6 on the chest. Then we have another test called the stress test, where you are exposed to some physically stressful conditions and told to run on a treadmill so we can identify exercise intolerance. Then there are some basic tests, like blood pressure test and pulse test, and chest auscultation with the help of a stethoscope. Let's move towards the medical treatment of valvular stenosis and valvular regurgitation. 1. We use diuretics in most of the cases. Diuretics are medicinal drugs that are used to reduce the water backup in the body. If we see swelling in lower limbs, face etc. along with a stenotic valve, we use a diuretic. So the patient urinates often but the water balance is maintained. 2. Then we use anticoagulants. These medications prevent the blood from clotting easily. The major side effect of these medicines is seen in case of cuts. The blood does not clot quickly, hence more blood loss is seen than usual. Heparin is the most common anticoagulant prescribed. 3. DAPT, or dual antiplatelet therapy. This is a combination of a blood thinner and aspirin. Hence the name dual antiplatelet. This medication helps treat angina and ischemic strokes as well. The most common DAPT is aspirin plus clopidogrel. For ACE inhibitors are the medications that inhibit the converting enzyme for angiotensin. This is the medication used in congestive heart failure due to poor valve function. A common ACE inhibitor is benazepril. 5. Beta blockers and calcium channel blockers. These medications decrease the heart rate and contraction, hence, the condition of valves does not deteriorate. The most common beta blocker is bisoprolol and the common calcium blocker is amlodipine. 6. Statins. These medications help maintain the cholesterol levels. LDL, also known as bad cholesterol, is maintained by these statins. 7. Digoxin is the medication used to increase the heart contraction rate. Hence to fulfill the backlog due to heart failure, but in return, the heart becomes weaker in the long run and surgery becomes inevitable. These were the broadly used medications for valvular heart disease. But these are not limited to these medications. Do not start these medications on your own, always take a doctor's opinion before. Now the other aspect of treatment is surgical treatment. There is constant improvement in the surgical treatment not only in cardiology but rather in all fields. Before, there was only one method to treat the valve disease, to open the heart and fix the valve, either by replacement or repairing. There are again two methods, repair of valve or replacement of valves. Let's first understand the replacement of valves. Biological valves of pigs or cows were used to replace the impaired valve. But these prosthetic valves need to be replaced every 5-10 years. Another method is to use mechanical valves. These use materials like plastic and metal. These have a longer life, but there are further complications like clotting near the valves. There is a new advancement. We can now replace the valve's transcatheter. Like in the case of PCI percutaneous surgery (MICS). We use a catheter and reach the desired valve and replace the valve using the same catheter, but less cutting and opening is required. Aortic valve replacement is beautifully performed by this method. Even mitral valve replacement can be done via the same method. This method is also called TAVR. Another method is called balloon valvuloplasty. It is very similar to TAVR. Percutaneously, the valves are overlapped with new artificial valves using a catheter. These developments are a boon to mankind, as these surgeries are easier, with fewer complications, and most importantly, the recovery is much quicker as compared to the old classic open heart surgery. Now let's understand the repair of valves. The impaired valves are repaired by removing valvular fibrosis and calcification. If the cords of valves are impaired, they are also treated. Hence in repair, valves are not replaced. They are just repaired and put back. I hope I have made this difficult topic easy to understand. So to conclude, I would say, prevention is better than cure. Have a good diet, exercise, stay happy. You live only once. Thank you so much for your patient listening.